We're back. Another episode of Emergency Medical Responder, Chapter 13, Environmental Emergencies. We're going to be completely honest with one another, and I just ask that you are honest with me because I'm going to be honest with you. This isn't all that fun. So we're about to get into the cool stuff, though. We're about to break off into some trauma and learn how to do some stuff and, all of that. With that being said, let's get started with environmental emergencies. And as you are aware, in Oklahoma, you have a lot of opportunities to treat somebody for an environmental emergency because it gets hot and it gets cold. So let's get started. So when a person is exposed to excess heat, the body's mechanism for regulating the temperature can be overwhelmed. What that means is how that manifests itself: heat cramps, heat exhaustion, heat stroke, pretty much in that order. We start cramping up, we start losing some fluids, losing some electrolytes, and then we get sick. So exposure to cold environments, they can result in conditions such as frostbite or hypothermia. You'll see some pictures in a second, as well as in your book, of hypothermia and how that can be a real problem too. So unintentional exposure to water can lead to submersion injuries and drowning. Hey, there it is, the patient assessment sequence. Scene size up, primary assessment, history taking, secondary assessment, reassessment. So, when we're thinking environmental emergencies, you think much like when we talked about maybe some kind of toxicology kind of stuff. So like say carbon monoxide poisoning, we want to get our patient from out of it, right? So if they're out in the hot sun and it's just it's beating them up and has them super sick, heat stroke or whatever, we got to get them out of there. If they're frozen, we got to get them out of there. So we got to get them in the back of a warm truck, wrapped up in some blankets, and get cold, wet clothes off of them, and all that stuff. So this, there's some similarities. So first thing, we want to make sure, as always, we review our dispatch information. What that can do is help us decide on some possibilities for our patient's problem. If they've been out all night and it's been a really cold night, or maybe they, have been trapped in a car that's been in the creek, or, all of these different things, that helps us kind of make some decisions about what we're going to do. So when we get there, no matter what, always, we're going to assess the scene safety for us, for our patient. We're always looking for scene safety. So now, as we perform our primary assessment, not a lot has changed. So we're going to try to form an impression, a general impression, right? We want to determine their LOC, or their level of responsiveness, level of consciousness, rather. And then we want to introduce ourselves, and then we're going to go into ABCs. Hopefully, they're going to be able to really tell us about their ABCs without telling us, just by, being able to put together well-spoken thoughts. Sorry, I'm having a hard day. As well as good airway control, so you don't hear any adventitious lung sounds, and you don't hear any gurgling and all of that stuff. Airway sounds good, breathing sounds good. You can just check their pulse real quick, and we can get a quick idea about our ABCs. Then we want to look into that chief complaint. So usually, best to collect a medical history of the patient experiencing a medical problem before you perform a secondary assessment, because we want to find out what's going on, So we're going to use that sample. We've talked about it multiple times. Quick review. Signs and symptoms, allergies, medications, pertinent past history. That'd be like, Bob, man, he was out in his truck out on the back 40, drove right off the bridge and landed in a creek. And when I was flying, we picked up, we never did pick them up, actually. We just left them there because they passed away. But someone who had been out, he was a rancher and had been out in the middle of the country, and his truck had toppled over into a creek, and it was a super, super cold night that night, and he stayed out in the water all night long. So that's a, pretty rough environment to be in, but that's a pertinent past history. That's what we're talking about with environmental emergencies. Last oral intake, and then, of course, events associated with or leading up to the injury and illness. Now, the secondary patient assessment, that focuses on those areas related to their current illness. So they don't always be aware of all the various aspects of his or her problem, but, we want to start looking into some things. And then want to get some vital signs, of course, and then monitor the patient, as we've talked about many times. Heat cramps, going to be very painful Involuntary spasms of muscles has a lot to do with electrolytes and fluid. Often occur after exercise, especially in the hot weather. The exact cause of heat cramps is not known, but it's thought to be related to the change in electrolyte levels that occurs during exercise and partly to dehydration that accompanies exercise or working in a hot environment. What I can tell you is we see the words, or in your book, you'll see the word exact cause of heat cramps is not known. Here's what we do know, though. We know it becomes a challenge for electrolytes, and it becomes a fluid challenge. And they start having those issues. Here's what we also know. We also know that when we correct the electrolytes and correct the fluid deficit, this stuff goes away. So we know that this is a fluid and an electrolyte issue. So if you're in Oklahoma in the summer and you got kids or adults that are, doing 2-a-days and all of that kind of stuff, these aren't going to be uncommon. Boot camp, those type of things, hard days are not uncommon to get some of these heat cramps for somebody. Problem is, as long as it stays there, we don't have a big problem. It's when it progresses that becomes a real big problem. So sometimes you can see them, you see it listed at leg or calf muscles. Sometimes it can occur in the abdomen. So that can be very painful. Treatment: move them to a cool place. Get them to lie down in a comfortable position. Give them something to drink. Can use a diluted, balanced electrolyte solution. It suggests Gatorade. If you know much about these type of drinks, you'll know that Gatorade probably has a lot more sugar than electrolytes that it needs to. Pedialyte is a good alternative. Just some salty water is a good thing because we need. One of the main things is what we've done is we've watered down the Kool-Aid. We've gotten everything so messed up in there. So once we start putting pure water, if we just water down, we just put in pure water, we're really just watering down that Kool-Aid. We need to get those electrolytes back in there to offset everything and go back to that word we've talked about, that homeostasis. So now, if cramps do not disappear, or if the patient is young, old, or has a chronic medical condition, then they may need to go to the appropriate medical facility. Now, heat exhaustion, we've moved on. Typically we start with some cramps, then we get into heat exhaustion. It occurs when a person is exposed to temperatures higher than 80, usually in combination with high humidity. So, that's pretty much springtime for us all the way through nearly Thanksgiving. So a lot of opportunities for heat-related problems here. But, a lot of this depends upon the person. It can also occur as a result of vigorous exercise at lower temperatures. And what I mean by the person is how well they're suited for that, how acclimated they are, how well they've prepared, so how much fluids they have on, their electrolyte status prior to all of that. But those signs and symptoms: profuse sweating, lightheadedness, dizziness, nausea, weak pulse, low BP. All of these things are due to losing all of that fluid. That's why they have a weak pulse and a low BP. Because they are hypotensive, because they are hypovolemic, they have low volume in their body. Predisposing factors may make some people more susceptible. So very young or older age, pre-existing medical conditions certainly can do that. Certain medications have some real issues with heat as well. High air temps, high humidity. So with that high humidity, it reduces the ability to lose heat through evaporation because the air surrounding is just so thick.
I'm having trouble.
Sorry, Siri. Siri's having trouble. So, treatment. What are we going to do about that? Move patient to the cooler place. Treat him or her for shock. Unless patient is unconscious or nauseated or vomiting, we want to give fluids by the mouth. Monitor our ABCs, and then they're probably going to need to go see somebody. And then top category here, heat stroke. That occurs when the body is subjected to more heat than it can tolerate, and normal mechanisms for getting rid of that excessive heat, such as sweating, are overwhelmed. So the patient's body temperature rises until it reaches a level at which brain damage can and sometimes does occur. Now, without prompt and proper treatment, a patient with heat stroke, they can potentially die. That is a up to and including death type of situation. So flushed, dry skin that feels hot to touch, that should be different than what we just talked about, isn't it? We talked about skin being wet, profuse sweating, all of that. So altered mental status, internal temps are up to as high as 104. ABCs, get them out of there. cool them down the best that we can, get clothes off, start cooling them, soaking them with water, begin aggressive cooling of patient with hose, shower, or ice packs. If they're conscious and not nauseated, then we can give them some cool water. And then, of course, we need to make sure they get to the right place. So here's what we're talking about. Heat exhaustion versus heat stroke. So normal versus high body temp, sweating versus not sweating, cool and clammy versus hot and red, dizzy and nauseous versus semi-conscious, or even potentially unconscious. So really, I mean, you're looking at one end to the other. I mean, they're pretty distinct between heat exhaustion and heat stroke, because that heat stroke has completely overwhelmed the body's senses and it's unable to cool itself down. So that's why we get into these signs and symptoms that we see. Now, frostbite can result when exposed parts of the body are exposed to a cold environment. Just here in Oklahoma City and central Oklahoma, it's not uncommon to see this, downtown. When you have somebody that stays out all night long for whatever reason, these type of things can happen, especially without proper gear. It can be a bad thing. So exposed body parts actually freeze when we start looking at this stuff. And the most susceptible parts are going to be face, ears, fingers, toes. Those are what we see the most. So depending upon the temperature and wind velocity, frostbite can occur in a short period. Increases in wind speed have the same effect as decreases in temperature. You've been between Oklahoma, and if you've been to other places that are super windy during the winter, that when you have the wind chill is very significant considering what the temperature actually is. That wind changes things so much. This graph kind of gives you an idea about the wind chill chart. Most susceptible people, much of the same things we've already seen. So old age, medical condition, exhaustion. Superficial frostbite. So affected body part becomes numb and then turns a bright red color. What happens is it eventually loses its color and then it changes to a pale white. There may be a loss of feeling and sensation in the injured area, so we're starting to see some nerve damage. Now, warming that, when we start talking about treatment, what does that look like? Warming a superficial frostbitten area or part must be done quickly and carefully. So simply putting the fingers, toes, or ears next to a warm body part is enough. So when you see people, yourself, you've sat on your fingers, or you put them underneath your arms or whatever, that's those warm areas of our body. So that helps to warm those guys up. Remember this, though, we're just talking about superficial frostbite now, frost nip. So we're not talking about, some real damage being done here. Treat patient for shock. Deep frostbite, that's superficial treat, in the event someone gets sick. And then we go to deep. Patient's skin will be white and waxy. Skin may be firm or frozen. Swelling and blisters may be present. If the skin is thawed, it may appear flushed with areas of purple and white, or it may be mottled and cyanotic. And mottled and cyanotic is bad because that's telling us that we may have done some real damage to the tissue. Treatment, going to be all the same kind of stuff that we talk about, the whole assessment sequence. And then deep. Once again, the whole assessment sequence, right? Remove any jewelry. Do not break the blisters. Don't rub the injured area. Don't do that. Don't apply heat. Allow patient to walk on an affected lower extremity. Don't let them do that. We just need to get them to the hospital is what we need to do. Hypothermia, below 95 degrees, occurs when a person's body temp drops less than 95. Person's body's not able to produce enough energy to keep that core temp or that internal body temp at a satisfactory level. People with inadequate or wet clothing, that's why we want to make sure we're getting all that stuff off of them, because those weakened by illnesses are most susceptible to hypothermia when they're in wet clothes or they have some type of issues within their body. Intoxicated patients and patients who have abused drugs are at an especially high risk for developing hypothermia. Not the greatest sensory perception things, So signs and symptoms: feeling cold, shivering, decreasing level of consciousness, sleepiness, all of those things. That's some of that stuff is what the body is just naturally doing. The body is naturally shivering, trying to generate heat, trying to make heat. Here's some characteristics of systemic hypothermia. You can see them listed. I'm not going to just read them to you. but you can see the differences. You see constricted blood vessels versus all the way up to cardiac arrest, weak pulse in the middle, lots of different pieces to that. So hypothermia, not a lot different. Move patient to a warm location. Remove the wet clothing. Get some warm blankets over and under the patient. If they're conscious, give them some warm fluid to drink. If you do not have access to a building, move them to a heated vehicle. So we're basically talking about an ambulance or a rescue squad or something like that. If transport's delayed, you may need to use your own body heat to warm the patient. Can't say I've ever done that, never just, like huddled up underneath a blanket together. You should hopefully have just a heater in your vehicle or whatever. But in the event you don't, I guess if you're on a mountain trapped, that's the next thing that we do. So handle them gently. There can be some cardiac issues when people get so cold. We can start to see cardiac issues. So that's what handle patient gently kind of means. And they need to be examined by a physician. So cardiac arrest and hypothermia. We mentioned that. If the body temperature falls to less than 83 degrees, really, really cold, our heart may stop. And if it does, you're going to need to begin CPR. So, throw on the AED and all of that. So one of the things that maybe you've heard, maybe you haven't, but you will, is people are not dead until they're warm and dead, because when they're cold, they can actually be kind of in this little stagnant phase and still be able to be resuscitated. So we need to warm those patients up, and as you see, not considered dead till warm and dead. Drowning. Each year, more than 3,500 people unintentional drowning. So additional 12,000 hospitalized because of injuries from submersion water. Second leading cause of injury and death among children, 1 to 14. A lot of times, as you can imagine, alcohol and drug abuse are involved. And what we're saying is that by drowning, process of experiencing respiratory impairment from suffocation or immersion in liquid. That's kind of what we're talking about by definition. So submersion injuries result from being beneath the surface of water or another liquid. So likely locations, we should be able to figure this out. Streams, lakes, swimming pools, hot tubs, anywhere there's a body of water. Likely location of drowning, wading pools, public food fountains, storm drain ponds. And those things are for kids as well. Bathtubs and toilets and mop buckets can all be real problems. I remember when I was on the ambulance, when I first became, I don't know if I was an EMT or paramedic, but we would have to answer the phones that from dispatch. They didn't give out medical advice over the phone. So they would call the paramedics at the station that was not on a call. And one of my friends got a call about a baby that had went head first into like an igloo container and had drowned just like that. Now, if I remember correctly, that baby was resuscitated. I'm almost positive of it. But we have, some of these things you think that just don't even make any sense. That's what happens. We're people, and people make some amazing and silly choices, and things happen. So, process of drowning progresses through several stages. So that initial stage is panic because that person realizes that something is wrong. In other instance, the person can become fatigued or injured or cold or entangled in seaweed or whatever. They experience a loss of orientation. They start to become ill. That feeling of panic, it produces an inefficient breathing pattern. So start breathing super fast and super shallow, not getting good air in there. If a swimmer is not able to take in full breaths, the ability to float is lost and exhaustion sets in. Small quantities of water reaching the larynx cause a spasm. So you start to see some laryngospasm starts to happen, and that makes it really hard, basically impossible to breathe. Now, if this cycle of panic is not corrected, then respiratory and cardiac arrest can result from as an end result of this. Signs and symptoms of submersion injury: coughing, vomiting, difficulty breathing, respiratory arrest, cardiac arrest, all these things. Treatment: scene safety. Getting somebody out of water, if you've not been properly trained in that may present some real problems for you. Don't be a hero and hop into swift water and regret that, because it's very simple. It's very easy to think that everything's okay, and it's not. So if the patient's still in water, do not exceed the limits of your training. Keep yourself safe and attempt only if you can do safely. So reach, throw, row, go sequence if you've seen that before. Call for additional help if needed. Evidence of trauma, need to move patient. Protect the spine. And then you perform a primary assessment. Correct any airway, breathing, circulation, so correct ABCs. Begin CPR if needed. If they're breathing adequately, then we probably want to administer some high flow O2 on them. As soon as the ABCs are stabilized, as soon as you get past that, dry the patient, cover them with some towels or blankets to help preserve the body temp, and then we start doing the secondary and start getting sample and all of that stuff that we've talked about. Now, cold water drowning. Should begin CPR on a drowning victim as long as the patient does not exhibit definitive signs of death. What you could call that is like when you look at something and go, oh yeah, they're not going to make it through that. Like, they've been decapitated or they have a hole through their heart or, they've been shot and all these other things. But when a person is submerged in cold water, there's a protective mechanism that's called a mammalian diving reflex. It can be activated. What happens is that reflex, it slows the heart rate and the metabolic rate and decreases the body's demand for oxygen. That's why we don't leave cold dead people cold and dead, because of what happens is everything slows down so much that there have been multiple people that have been resuscitated post cold water drowning, and they've come up with hardly any deficits, if any, because the metabolic rate slows so far down. Now, if you're out in Lake Draper in Oklahoma City, that water doesn't get cold in the summer, so that's not what we're talking about. But your book will tell you there's been instance of survival of patient submerged for over 30 minutes due to this reflex, that mammalian reflex. So when you encounter a person who has been submerged in cold water, even for an extended period, CPR should be started and continued until they've been delivered to the appropriate medical facility. Here's my take on a lot of these kind of things. That's not our place to decide basically when someone's dead. Now, if they've been shot and ran over and all that kind of stuff, that's one thing. But if there's a question as to whether you should do CPR or not, just do it. Wait till let somebody else that has more training or more definitive decision-making skills, let them come up and do that. We're there to do what we can, and good, high-quality CPR is one of those things that we can do. Lightning injuries. Electrical injury resulting from a lightning strike because of all of that electricity being inserted really quickly. It can cause cardiac irregularities or even up to cardiac arrest. So we treat patients who have been struck by lightning by A, B's, and C's. Again, you can throw some O2 on them. Defibrillation and CPR may be needed for some patients. And of course, transport. It can cause electrical burns because, things, they still got to go places. All that energy has to go somewhere. It may come out, it may not. But the type of burn is mainly internal. So the extent of burn damage, not going to be visible right away after that injury occurs. And then bites and stings. So sometimes classified as environmental injuries or discussed under the topic of poisoning, but we've already talked about this on our previous lecture. So heat cramps, remember electrolyte imbalance, dehydration, we start seeing lightheadedness, dizzy, all of that. Heat strokes overwhelm the body sweating mechanism. Then we get into cold. Injuries. So some frostbite, superficial frostbite. Hypothermia occurs when the body's not able to produce enough heat to keep everything normal. And then, remember, cold and dead's not dead. You need to be warm and dead. And then drowning, lightning injuries. That's it. This has been our fastest one. I don't want to say it's been our least productive. I feel like we did good work. But after this, we're going to get into some trauma. And most people like to deal with some trauma. So be prepared. Chapter 14, bleeding, shock, and soft tissue injuries. That's where we're headed. And I'll see you there.